Have you ever wondered why mental health is just as important as physical health, if not more so? This question, my friends, is not just a rhetorical one. The truth is, mental health touches every aspect of our lives. It influences our thoughts, feelings, and behaviors. It affects how we handle stress, relate to others, and make decisions. In the past, society often overlooked mental health, focusing more on physical well-being. But over time, our understanding has evolved. We've come to recognize that a healthy mind is not just about not having mental health problems. It's about leading a balanced life that allows us to manage stress, work productively, make meaningful contributions to our communities, and realize our full potential. Mental health is intertwined with our physical health. A troubled mind can lead to physical illnesses, while physical ailments can also impact our mental state. It's a two-way street. For instance, chronic conditions like heart disease or diabetes can lead to depression, while mental health issues such as anxiety can exacerbate heart problems or hinder diabetes management. Mental health is also fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. On this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern of individuals, communities, and societies throughout the world. Societal understanding of mental health has come a long way. We've moved from viewing mental health issues as personal failings or moral weaknesses to recognizing them as real treatable conditions. Mental health care has evolved too, from the stark impersonal institutions of the past to a variety of treatment options today, including therapy, medication, and community support programs. Yet, there's still much work to be done. Stigma and misunderstanding still surround mental health, and many people don't get the help they need. But with ongoing research and increasing public awareness, we're making strides towards a world where mental health is given the attention and understanding it deserves. Indeed, mental health is a crucial aspect of our overall well-being, and it's high time we started treating it as such. So, how did our understanding of mental health develop over the years? Let's journey back to the late 19th century when Sigmund Freud, a young Austrian neurologist, began to explore the mysteries of the human mind. Freud's theory of psychoanalysis suggested that our behaviors, thoughts, and feelings are largely influenced by unconscious drives and past experiences. This was a revolutionary idea, challenging the long-standing belief that mental illness was a result of physical ailments. Freud's couch became a symbol of introspection and self-discovery, as patients were encouraged to talk openly about their dreams, fears, and desires. This talking cure, as Freud called it, was the birth of psychotherapy, a cornerstone of mental health treatment even today. But Freud's theories were not without their limitations. They were often criticized for being overly focused on early childhood experiences and sexual drives, and for lacking empirical evidence. Fast forward to the mid-20th century, the era of the first antipsychotic medications. Chlorpromazine, the first of its kind, was introduced in the early 50s. It was seen as a miracle drug, transforming the lives of those living with severe mental illnesses, such as schizophrenia. These medications work by altering the chemical balance in the brain, thereby reducing symptoms. But again, these treatments were far from perfect. They often came with severe side effects, and they did little to address the underlying causes of mental illness. Despite these limitations, these early theories and treatments marked significant strides in mental health research. They shifted the focus from the physical to the psychological, from the observable to the invisible. They recognized mental illness as a legitimate health concern, deserving of scientific inquiry and compassionate care. Yet there was still a long way to go. The complex nature of the human mind demanded more nuanced understanding and more effective interventions. And so the quest continued, driving researchers and clinicians to explore new frontiers in mental health. While these early theories and treatments laid the foundation for mental health research, they left much to be desired. But as we'll see in the next segment, the advent of neuroimaging would soon revolutionize our understanding of the brain and mental illness. Enter the era of neuroimaging, a game changer in our understanding of the brain and mental health. As the 20th century drew to a close, an exciting new frontier in neuroscience and mental health research began to emerge. Picture this: a technique that allows scientists to peek into the human brain to see its structure and function without a single incision. This isn't science fiction, it's neuroimaging. You've probably heard of MRI or magnetic resonance imaging. This non-invasive technique uses powerful magnets and radio waves to create detailed images of the brain. But it's not just about producing pretty pictures. MRI scans give researchers invaluable insights into the brain's anatomy and can help identify abnormalities linked to mental health conditions. Then there's PET, or positron emission tomography. This imaging technique goes a step further, allowing scientists to study brain function. By tracking the movement of a harmless radioactive tracer injected into the bloodstream, PET scans can highlight areas of the brain that are more or less active, providing clues about how different mental health conditions affect brain activity. These neuroimaging techniques have revolutionized our understanding of the brain, offering tangible visual evidence of what was once a hidden world. They've helped to debunk myths, challenge stigma, and transform our approach to mental health treatment. For instance, neuroimaging has revealed that depression is not simply a case of feeling sad. Instead, it involves specific changes in brain regions associated with mood, thinking, and behavior. Similarly, neuroimaging has shown us that conditions like schizophrenia and bipolar disorder are not due to personal failings or lack of willpower, but are associated with distinct patterns of brain activity. But perhaps the most exciting aspect of neuroimaging is its potential for the future. As these techniques continue to advance, they promise to unlock even deeper understanding of our complex brain, paving the way for more effective, targeted treatments for a range of mental health conditions. Neuroimaging opened up a whole new world of possibilities, bringing us closer than ever to understanding the complexities of the human brain. But what if we told you that some of the most promising breakthroughs in mental health treatment involve psychedelic substances? This might sound like a wild ride, but hold your horses because this is not about recreational use. It's about harnessing the power of these substances in a controlled therapeutic setting to help individuals navigate through mental health issues. Welcome to the fascinating world of psychedelic-assisted therapy. This emerging field is capturing the attention of researchers worldwide, with a focus on substances such as psilocybin, found in magic mushrooms, and MDMA, more commonly known as ecstasy. Now let's take a moment to clear a common misconception. When we talk about psychedelic-assisted therapy, we're not suggesting a free-for-all. This isn't about self-medication or recreational use. Instead, these therapies are carefully guided by trained professionals in a safe, controlled environment, and the substances used are often in purified, measured doses. So, how does it work, you might ask? Well, in simple terms, these substances can help create a state of heightened awareness or altered consciousness. This can allow individuals to explore and confront their emotions or traumas in ways that might be difficult in conventional therapy. Recent studies are showing promising results. For example, research on psilocybin-assisted therapy for depression has shown that it can produce long-lasting reductions in symptoms. Similarly, studies on MDMA-assisted therapy for post-traumatic stress disorder have reported significant improvements in patients' symptoms and overall quality of life. But it's not all sunshine and rainbows. Like any new field, psychedelic-assisted therapy comes with its own set of challenges. Ensuring safety, determining correct dosages, and understanding long-term effects are just a few of the hurdles to overcome. But the potential benefits are immense. Psychedelic-assisted therapy is a fascinating new frontier in mental health treatment, with the potential to transform countless lives. As research continues to evolve, we may be on the brink of a paradigm shift in how we understand and treat mental health. And now, we're entering an era of personalized psychiatry. Imagine a world where mental health treatment is as unique as your fingerprint. A world where your treatment plan is tailored not just to your symptoms, but to your genetics, lifestyle, and environment. This is the promise of personalized psychiatry. In the past, psychiatry followed a one-size-fits-all model. Everyone with the same diagnosis received the same treatment, regardless of their individual differences. But we now understand that mental health is far more complex. Personalized psychiatry recognizes this complexity and seeks to address it. This approach is grounded in the understanding that our genes, lifestyle, and environment all interact to shape our mental health. For instance, certain genetic factors may make us more susceptible to stress, while our lifestyle and environment can either amplify or mitigate this susceptibility. Personalized psychiatry takes these factors into account when formulating a treatment plan. So, if two people have the same diagnosis but different genetic profiles, lifestyles, and environments, they may receive different treatments. For example, someone who has a genetic predisposition to anxiety might benefit from a combination of cognitive behavioral therapy and medication. But if that person also lives in a high-stress environment, their treatment plan might also include stress management techniques. Likewise, a person with depression who has a sedentary lifestyle might benefit from incorporating regular exercise into their treatment plan, along with therapy and medication. The potential of personalized psychiatry is vast. By tailoring treatment to the individual, we can potentially improve outcomes significantly. It could mean fewer side effects from medication, quicker recovery times, and ultimately, a better quality of life for those living with mental health conditions. But it's not just about treatment. Personalized psychiatry can also play a role in prevention. By identifying genetic risk factors early on, we can take steps to mitigate these risks and potentially prevent the onset of mental health conditions. Personalized psychiatry is the future of mental health treatment, promising more effective and individualized care. So what's next for mental health research? As we look toward the horizon, the future of mental health research is teeming with potential. The advancements we've seen so far are just the beginning. Let's imagine a world where mental health is understood just as clearly as physical health, where stigma is replaced with empathy, and where treatment is as personalized as your own fingerprint. First off, neuroimaging. This field is already pushing boundaries, but there's still much to explore. The human brain is a complex marvel, and we're only beginning to understand its intricacies. Future advancements may allow us to visualize mental health conditions in real time, providing a window into the brain that could revolutionize diagnosis and treatment. Next, let's talk about treatment modalities. As we've seen with the rise of psychedelic-assisted therapy, sometimes the most effective treatments come from unexpected places. The future could see the development of entirely new treatment modalities, perhaps even ones that blend technology and therapy in ways we can't yet imagine. Moreover, the concept of personalized psychiatry is set to take center stage. Imagine a future where treatment is tailored to an individual's unique genetic makeup and life experiences. This could involve the use of advanced algorithms that can predict a person's response to different treatments, leading to more effective and efficient care. We also anticipate that the integration of mental health care into primary healthcare systems will become more widespread. This would ensure that mental health is considered a fundamental part of overall health and not an afterthought. Finally, we foresee a future where research is driven by those who are most affected, the patients themselves. Their voices, experiences, and insights could guide the direction of research, ensuring it remains relevant and impactful. The future of mental health research is bright, and we can't wait to see what breakthroughs lie ahead. This is an exciting time to be involved in mental health research. The possibilities are limitless, and the potential to change lives is enormous. So, let's keep pushing forward, keep questioning, keep discovering. Because every breakthrough brings us one step closer to a world where mental health conditions are understood, treated, and perhaps even prevented. Let's take a moment to reflect on what we've learned. We started our journey recognizing the importance of mental health, acknowledging it as a cornerstone of our overall well-being. We've come to understand that our mental health significantly influences our daily life, from our relationships and productivity to our physical health. We then journeyed back to the early days of mental health research, a time when understanding and treatment were limited. We marveled at how far we've come from that era, where the complexities of the human mind were often misunderstood and stigmatized. Next, we delved into the advent of neuroimaging, a game-changer in the field of mental health research. This technology has allowed us to peek into the workings of the brain, enhancing our understanding of various mental health conditions and helping us develop better treatment strategies. Our journey took an exciting turn as we explored the world of psychedelic-assisted therapy. We learned about the potential of substances like psilocybin and MDMA to revolutionize treatment for conditions like depression and PTSD, opening up new pathways to healing. We also touched on personalized psychiatry, a novel approach that tailors treatment to the individual's unique genetic makeup and life experiences. This approach underscores the importance of treating each person as a unique individual, not just a set of symptoms. As we looked forward, we imagined the immense possibilities for the future of mental health research. With the continual advancements in technology and our growing understanding of the human mind, we are optimistic about the prospects of improved treatments and reduced stigma around mental health. In conclusion, we've journeyed from understanding the importance of mental health through the early days of its research to the breakthroughs of today and the exciting potential of tomorrow. The field of mental health is continually evolving, and we're excited to be part of this journey. Remember, mental health matters. And if you want to keep up with the latest in mental health research and treatment, don't forget to subscribe to our channel.